Hello everyone, I am Dr. Queen Aditya from Kolkata. I am a gynecologist and as a doctor would like to speak to you, especially to the women, about the current condition that we are in. The lockdown due to the corona threat is ongoing. Maybe the lockdown will be relaxed soon, but the corona threat is still there. It is far from being eradicated. The disease is there. It will stay with us for quite some time until a proper vaccination or medication is found. We still have to live with the threat, and we are all at risk of contracting the infection because, as we all know, it is a droplet infection which spreads from person to person. Thereby, we all have to maintain the social distancing that we were told about 2 months back. The same rules follow and will continue for quite some time now. Hand washing at least for 20 seconds each time, wearing a face mask, avoiding contact with people, physical contact, at least maintaining 1 to 2 meter distance from anyone, and staying indoors, maintaining social distancing, trying not to go outdoors unless there is a dire emergency. These things will continue. Now, those of us, the women who are currently in the state of pregnancy, those who are pregnant are actually very concerned because they do not know how and when to reach the doctor. They are wary. Maybe the doctor is not giving frequent appointments. Maybe it is not possible for you to go and reach your doctor that soon, but please do not panic. Today's day we are all following teleconsultation, and I'm sure your doctor will do the same. You can talk to your doctor or even message your doctor and get a reply regarding your medications. Whatever tests are required, we are trying to minimize your number of visits and also the number of tests, but some tests are inevitable. As for example, the blood tests that are done right at the beginning, then a sugar test that is done in the mid-pregnancy because diabetes is common in pregnancy, especially in India. Some ultrasounds are absolutely inevitable, that at 12 weeks and that at 20 weeks, and if possible we'll do another one when you are 32 to 34 weeks. So these are the few tests that need to be done. If you cannot visit your doctor or you are scared to do so, you can send your reports over, we will check them and we will revert to you. And you might reduce your number of visits once a month. Instead of once a month, you can go once in 1.5 or 2 months. And when we give you an appointment, we usually try to space out the appointment so that we call everyone every 15 to 20 minutes so that there is not too much of crowding in our chambers in the waiting space. And we ask you to come with fewer family members. So these are the things that we have to follow. The usual tetanus injections and the other medications will continue. We will guide you over the phone. For the delivery, when there is no contraindication for a normal delivery, whether you will go for a normal delivery or a cesarean, you will have to discuss with your doctor beforehand. And nowadays there is facilities for testing corona or COVID. So most of the patients we are admitting and getting the test done, and once the test is clear, then we plan the mode of delivery. Or if there is some other way, then you have to speak to your doctor who will be managing your case. So this is about the corona situation and your delivery. And at the time of delivery, please do not call too many of your family members because again, we do not want crowding. We want to maintain social distancing. In India, we follow the 7-month ritual called Bod Bharai, or we call it Shad in Bengali. But nowadays, in this current scenario, we would request you to keep it to a minimum with only the family members and do not call people from outside. You will have time to rejoice later in life once we are through with this deadly disease. And so this is about pregnancy, and after delivery you are not stopped from breastfeeding your child. Breastfeeding is allowed even if someone is corona positive and also those who are negative, but you should still maintain social distancing as much as you can. You should wear a face mask, you should wash your hands before handling the child. So these things have to be maintained. Now World Menstruation Day is just around the corner, and menstruation is something which is unique to us, the women, and it is something that we should not be scared about, or even we should not, be embarrassed about it. It's integral to us, and the fact that we are menstruating shows that later in life we will be able to harbor a child in our own self. So it's a matter of pride as such. So there are a few things about menstruation I would like to tell you. That the fact that it comes once in 28 days is actually overrated because it's not always that time bound in everyone. The cycle can vary from 21 to 35 days, and any of this is normal. If you have very frequent cycles, that is less than 21 days regularly of it, or it's more than 35 days, regularly, then there might be some hormonal or other disturbance for which you might have to visit a doctor. So this is number one. During the menstruation, we have to maintain cleanliness. Cleaning the local area should be done from the front to the back. The pads should be changed frequently. It's good if you can manage to do so once every 6 hours. If there is heavier flow, it might need to be changed even more frequently. Proper disposal of the menstrual pads so that we do not contaminate our surroundings, so that the society is clean. That also has to be maintained. And if we cannot afford sanitary pads, and proper clean cloth has to be used. In the rural areas where a lot of girls do not have access to the sanitary napkin, clean cloth will also do. Proper washing of oneself is also to be maintained. And one very important thing is that during menstruation, a girl is not achut. The girl is not untouchable. There is nothing of that sort. We are the same person that we otherwise are. So please, if anyone in your family or your surroundings is trying to make a taboo of it, please try to tell them. And it's for the parents of the girl, the adolescent also, that it is not a state where the girl is an untouchable. Please do not add to her anxiety. Please try to treat her as a normal individual, and because she actually is so. And thereby, on this coming World Menstruation Day, I request you all to take it in your stride and help the girls, especially the young girls who have recently started menstruating, to gradually get adapted to it and to allay their anxiety. And once again, I thank you all for your patient listening. We are going through a very bad phase, the corona pandemic, and recently in West Bengal we also suffered the cyclone and its aftermath. We all have to be together and stand strong and help each other in spite of maintaining social distancing. Thank you so much.